Hello and welcome to this edition of To Your Health. I'm Kendra Szymanski, the Chief Operating Officer at Marlborough Hospital. Today we're going to spend some time talking about depression. As I was preparing, I was a bit overwhelmed at the numbers. So 1 in 9 adults experiences some form of depression, and often we're reluctant to talk about it with either our primary care doctors or a mental health professional. We do try to talk to our friends sometimes and they try and cheer us up, but that's not really the right way to treat depression. We really have to begin to think about it as a serious medical illness, just like we think about heart disease or diabetes. And I think very often we try to still hide the fact, or we see it as a significant weakness when we have a mental health issue. So today we're going to spend some time talking about depression, which actually is the major cause for disability in America for people between the ages of 16 and 44. I was just really surprised at that number. So joining me today, I have 2 guests. The first half of the program we're going to spend with Dr. Terry Smith, and the second half with Heidi Donnellan. Dr. Smith is the Medical Director for Psychiatric Services here at Marlborough Hospital. He is also an Assistant Clinical Professor at the UMass Medical School. Which keeps him very busy, by the way. In addition to that, he is a graduate of Quillen College, and I hope I said that right, in Johnson City, Tennessee. And he completed his residency at Boston Medical Center, which is, of course, part of the BU system, and is board certified in psychiatry. And Dr. Smith, you have been here at Marlborough Hospital for?
About 7.5 years.
Well, I was going to guess 5. See how time flies. But you know, I feel very fortunate that you found us and joined our medical staff when you did. So we're going to spend some time talking a little bit about depression. Now, is there a way to sort out what's depression, what's being down in the dumps, what's just feeling kind of blue? Is there a difference, and how do you sort that out?
There is a difference. When we talk about the blues, that's usually a short period of time of feeling down that most of us have experienced at one time or another, usually due to feeling tired, some life stressors. Clinical depression, on the other hand, is a significant disorder. Is classified as a mood disorder in which feelings of sadness, loss, anger, frustration cause significant interference with everyday life. And it usually lasts for a much longer period of time. When people feel depressed, they have problems in different parts of their lives, work, school, social and family relationships. Treatment for clinical depression often involves medications such as antidepressants and even hospitalization in very severe cases.
So, you know, feeling blue is not unusual if you've experienced a loss or if you're disappointed because something just didn't go right. Mm-hmm. But based on what you just said to me, that's pretty short term. I can, you know, just go on with life, and you know, yes, I'm a little sad, but it doesn't really seem to get in my way in terms of how I function. So, major depression then. Are there a list of symptoms? Is it different for each person? I mean, how do you sort that out?
Sure. Like you said, when people have the blues, that's a normal part of being human. Everybody has good days, bad days, moods go up and down a little bit. But depression really impairs the way we live. It really affects the quality of life and lasts much longer than just being down. In terms of possible symptoms, people who have depression experience many of the following symptoms nearly every day for at least 2 weeks. 2 weeks. And these symptoms include having depressed mood, a loss of interest or pleasures that they usually enjoy. They complain about having low self-worth. They can feel worthless or helpless. People who are depressed often complain about decreased concentration. They can't make decisions. Depressed people often feel very tired or sluggish. there could be changes in appetite. Either they eat more or they eat less. And changes in weight can go with that as well. We often see people who have depression have insomnia. They have trouble falling asleep, or they wake up too early in the morning. They complain about feeling guilty. They often have passing thoughts about suicide or death.
It's still, good days, bad days. I can catch up with you, but the feelings that you're talking about sound like they're like overwhelming, and they're every day.
Yeah.
You can't talk yourself back out of these. It's not the blues that you can, like I said, talk yourself back out of. So either I eat too little or too much, don't get dressed. I mean, do people not go to work? How do if I'm sitting at home, I might be saying, oh my goodness, I think I have some of those every day, off and on, especially, this time of year when, there's not enough sunshine and we're not getting out enough, we want to hibernate. So how do I sort all that out?
Well, it's typically a matter of degree and how long it lasts. Oftentimes, I will talk to family members of patients, or people who know the patient, and they will say, yeah, Sally or Bob, they seem different. I've seen them down before. They seem different now. And the main thing that gets hit in depression is a loss of self-esteem. There's a major change in the way the person sees themselves, and it's visible to other people.
So they just don't care. They're not clean and neat anymore, perhaps, if they always were.
Right.
I mean, so physical things you can see, and then their attitude or their interest.
There's a sense of giving up. There's a sense of things are not good, and I don't think they're ever going to be good. That kind of helplessness and hopelessness that affects their self-esteem and, again, how they function in the world. There's a major change, and it doesn't go away in just a couple of days. It can go on for weeks, even months, without treatment.
Now, are there physical symptoms? And for example, would somebody get pain, headache? Of course, you said fatigue, which would come from the insomnia. But are there other type of physical symptoms someone might get?
Yes, you mentioned pain. A lot of people do feel that they have pain, belly pain, constipation or diarrhea, headaches, lightheadedness. Some of this might be due to the side effects of depression, like not eating, not sleeping, not taking care of themselves. If people used to exercise before, when they're depressed, they just don't feel like doing that. So some of the physical symptoms can come from that. Sometimes it's the physical symptoms that tip us off that something is really going on and may cause us to wonder, are you really depressed right now?
So what causes depression then, Dr. Smith? I mean, I think it still has that stigma of being some kind of a weakness, but there are real reasons that people get depressed.
There are, and I will mention that sometimes it's frustrating for a person who suffers from depression when other people don't really understand it because they themselves have not gone through it. They say, why are you depressed? Everything seems to be going well.
That's such a valid point, yeah.
Yeah, and it can be very frustrating.
Yeah.
But in terms of causes, there are many possible causes of depression. Alcohol and drug abuse, childhood events such as abuse and trauma, social isolation, some kind of a loss often precipitates. It can be the loss of a job, loss of a body function because of illness. Certain medications can cause depression, and medical conditions such as cancer or hypothyroidism can cause depression as well. We're learning about vitamin deficiencies such as vitamin D can cause it. So it's multifactorial.
So vitamin D is tied to the sun.
That's correct.
I do know people who feel so much better summertime when the sun's out. Now, postpartum women, right? After you have a baby, you would think it's like the most, for the most people, it's a very, very happy time in their life, but they can have significant depression.
Absolutely. We recognize different kinds of depression as well. You mentioned postpartum, following the birth of a child. Some people suffer from holiday depression around the holiday times because they have to be with family or they miss their families. There's a variant called seasonal affective depression, which, as you mentioned, exposure to the sunlight, these are folks who become very depressed in October and feel much better by April, and that's caused by the lack of exposure to sunlight.
Now, folks who, I think about, our armed forces overseas as things continue to, evolve in Afghanistan. PTSD, does it carry a portion, is depression part of the post-traumatic piece?
Although depression is not one of the criteria for PTSD or post-traumatic stress disorder, they often go hand in hand.
They do.
Yes,
Yeah.
because the symptoms of that persist and that makes the person very depressed.
So, based on what I read, depression can be very, very complicated. Is it challenging to diagnose? Or is it based, clearly you interview a patient and, as you said, you talk to family members, and so is there a criteria that you go by, that you have to have 6 out of 7 of the following, or how do you discern
Yes.
whether someone's clinically depressed or?
There's a manual that we refer to called DSM, Diagnostic and Statistical Manual. Say that 5 times.
I know, believe me, I read about it.
And there's actually a diagnosis called major depressive disorder and a major depressive episode. And one must have 5 of 9 criteria. I named many of them earlier about them. And that helps us to distinguish by when somebody's depressed, it might actually be part of something else called bipolar disorder. Okay. It could be part of a psychotic disorder. So it's very difficult to tease apart. Often takes several conversations, a very thorough psychiatric assessment, and usually involves talking to family members and other people who know the patient very well.
So does psychiatric illness then run in families?
It can. Depression often runs in families. It's not clear if somebody is born with a tendency to become depressed or if it's because of exposure to other depressed family members. I'm guessing it's probably a combination of both.
So what we've heard is that certainly there are various symptoms. You gave a number, but it's really about the fact that how much is this impacting my ability to go to work, go to school, to function with my daily activities. What advice do you give to people? Go to your primary care doctor? How do you? What are the first steps in terms of asking for help?
The person really needs to recognize that something is different now, that this is not some kind of passing, having the blues, or maybe a little more sleep will be fine. They should definitely listen to other family members or friends who are trying to give them clues as to something is really wrong. Maybe it's time to go talk to a professional.
Great. Well, Dr. Smith, believe it or not, our first half of our program is up. We've laid a great foundation to chat now with Heidi around treatment and what Marlborough Hospital has to offer. So once again, thank you so very much for joining me, and we'll be right back. Hello and welcome back. I'm Candy Szymanski, and this is To Your Health. Today we're talking about depression. So the first half we spent some time with Dr. Terry Smith and talked about signs and symptoms, does it run in the family, and tried to sort out the difference between the blues and really major depression. So the second half of the show we're going to focus on treatment. We'll start with general treatment and then provide you with some information about what treatment is available at Marlborough Hospital. So joining me for the second half of the show is Heidi Donnellan. Heidi is a licensed social worker. She is the manager for our outpatient partial hospital program. We'll ask her to tell us a little bit about that. And then, I think it's important for you to know that Heidi has been chairing our Patient and Family Advisory Council, and not too long ago we did do a To Your Health segment about how important that council is to us. Heidi really was very instrumental in getting that off the ground and chairing it, and for that, we are certainly grateful for all of your support in that regard. So Heidi, you have been with Marlborough Hospital now for, I'm going to guess, 10 years? No, 8 years.
It's actually 11 years come this May.
So we arrived here right around the same time.
Yep.
Wow. Well, I'm glad you've stayed with us because you've really done, really have grown our outpatient psychiatry services tremendously. So we were talking to Dr. Smith, and we ended with, trying to decide how to seek treatment and where do you go first. And I thought maybe we could pick up on that just a little bit. So he reviewed signs and symptoms, and he said, shared with us that often other people will really notice that something is just not quite right and perhaps encourage us to seek treatments. What are your thoughts? When does somebody say, okay, this has gone on too long, I don't think this is the blues, I think I need some help?
So I think Dr. Smith hit on some real important points, and depression is, I think everybody has some degree of depression, so how do we manage it? What are we doing on our own? Are we getting enough sleep? Are we getting enough to eat? Are we exercising? Are we taking a few steps in our own hands? Are we talking to our family and friends? Are real important steps. But if you're starting to see that that's not enough and you're not quite getting better, or it's continuing to linger, then you really need to look to see, what else can I be doing? Where else do I need to go? Talking to family and friends are helpful, but unfortunately, they're in a position where they can't be neutral. They're there, they want to help. And that's when you need to think about, this might not be working, who else can I talk to?
Now, we talked a little bit about, if it goes on for like 2 weeks. Clearly though, 3 days of feeling so bad, you really think you might hurt yourself, means that it doesn't have to go 2 weeks.
No, it doesn't have to go 2 weeks, and you really need to keep an eye on that, especially if you're talking about, I'm having some thoughts that, I just don't want to do this anymore. I don't want to be here anymore. That's serious, and that's when you need to immediately seek help. Whether it's walking into your local emergency room. Every emergency room in the state of Massachusetts is equipped with an emergency screening team you can ask them for help. They will evaluate and help you make some decisions. Whether it's calling 911, whatever you need to do to access that more immediate help is real important to do and look at.
So, I can have some symptoms of depression, but as soon as I start thinking about suicide or just giving up, that's the time that there should be a flag. Now, would most people say to somebody that they care about, you know what, I just can't do this anymore, or do they really keep that very private to themselves and you don't have a clue?
I think some people do, but I think that's where supports and friends and family can really pick up on, is there something more going on. When you start to see folks, saying their goodbyes or giving away belongings or starting to do some real unusual things that you haven't noticed, the family and friends really need to say, what's happening here? How can I help you? Yeah. And if they're continuing to refuse, that's when that family member might need to take that action and bring them to an emergency room or call their local screening team. Or call 911, because you really want to make sure, if the person isn't able to tell you or isn't looking themselves and acting really out of the ordinary, you need to get that assessed.
So I just didn't want to lose sight that there are certainly people who become very depressed and very desperate very quickly. And I didn't want to lose sight of that before we ran out of time. So what kind of treatment is available for people who are having a bout of depression?
So there's multiple treatments that are available out there, and they go for different kind of criteria in terms of different levels of severity. You have folks that certainly outpatient, meeting with a therapist. Once again, I had alluded earlier, someone who's not a family or friend, someone who can really help you look at what's going on here. How can you look at things? How can you take care of yourself? Someone who's not directly involved in that manner, but who's more open to kind of looking at all angles and looking at a variety of things. So there's outpatient therapy. Medications may be sometimes necessary. Seeing a psychiatrist or a nurse practitioner licensed to prescribe can be helpful as well. The combination of medications and therapy together has proven to be very successful. If outpatient isn't working and you're feeling like it's just not doing me a whole lot, then you need to look at the next level of care, which would be a partial hospital program or an intensive outpatient program, which is more than once a week therapy. It sometimes can be an all-day therapy session, meaning a group type focus session along with psychiatry help, or it could be meeting with a therapist several times a week. There's different types of those.
So
And
would I start normally with my primary care provider?
you could start with your primary care, ask them for some information on who is out there, who would they recommend. You could call your insurance company and say, every insurance company has a behavioral or mental health side. If you look at the back of your card, it should be right there. If not, customer service will get you there and say, I'm having this issue, I'd like to start by looking at a therapist, and they should be able to provide you with that
Oh,
list.
that's great. You're absolutely right that often they do contract with another provider to
Yeah.
provide mental health.
Yeah.
That would be a great resource,
And a
especially
lot
if you
of-
were reluctant not to go to your primary
Right.
care
And if you
provider.
don't feel like making the phone call, hopefully you have access to a computer. Every insurance company also has a website that will connect you to their services as
Great
well
thought.
and what's out there. So
Great
that's
thought.
helpful.
Great thought.
There's a lot of, there's a lot of just phone numbers in your local area. Locally here we have a local emergency screening team. So even just picking up the phone and calling your local screening team, your local emergency room who can get you to those right people would be important to do.
You know, Heidi, I noticed online there are a number of quizzes you can take. Any thoughts about those? I mean, clearly I know you must have reviewed them. And you do some screening, I know, on occasion. So is there just thoughts about those tools?
I think they can be helpful to give you some understanding, but I'd be cautious as to the outcomes without checking with a professional. If you're taking a test, because you see them in the magazines, you see them, online.
Right.
I think you could take them just to get a basic understanding, is there
Yeah.
something going
Yeah.
on or not?
Yeah.
But I would certainly want you then to follow up with your primary care, with a
And certainly
professional.
if you really Googled depression or
Right.
and you were looking for something specifically, that says to me that you're really very concerned. And you
Right.
need
If you're
to-
taking that step to look into it, to
Yeah.
take a test, to make a call, or to even think about it, then there may be something more there to get some support on.
So I kind of cut you off because I wanted to just go down that track because I think it's a valid point that a lot of people have access to the internet and they do use it pretty frequently. So we talked about psychotherapy, some medication, and then you mentioned a partial program where the treatment is more intense. It might be daily treatment. Tell me a little bit about that, especially as it relates to the program that you have oversight for here.
So partial hospital I like to think of as the hidden jewel. People think I'm either an outpatient or I have to be in a hospital, and that's not necessarily true. Partial hospital is kind of this in-between level of care where folks are there from usually 6 hours a day, 9 to 3 in our specific program, really working in a group setting to understand how am I doing, how am I feeling, what's going on that I need to be aware of so I can help myself, so I can look at making some healthy changes to feel better, to take care of myself, take care of my symptoms, so I can get back to the things that I want to be doing.
So coping skills or just gaining more, first of all, gaining more insight
I
into
think
these
it's insight,
symptoms?
it's learning insight, learning better ways to take care of myself, looking at alternatives, looking at things from the other side. Sometimes when we don't feel good, everything is very negative. Everything, is kind of, the glass is half empty. In our partial program, we help you look at the glass can be half full. And how can you do that? How can you challenge some of that insight and that thinking that you've had, that you've probably gotten to this point, and look at how to look forward in a different way?
So do I have to be referred to the program or can I self-refer?
You can self-refer. It's always helpful if you're working with someone for them to do a referral form, which is available right on the Marlborough Hospital website, just so we have some thoughts on kind of what you've been working
Yeah,
on.
yeah.
But if you have nobody or if you don't have a source of referral, certainly call yourself. Whoever answers the phone, it's usually the secretary,
Yeah.
will take down some basic information and give it to a clinician to follow up on.
And then you'll call and follow
Yeah.
up. Now, if I decided to go to the emergency room and go through the psychiatric emergency screening, I could still get referred to an
Yeah.
outpatient program versus being inpatient.
What I want to be clear on, I think going to the emergency room if you're really not sure what to do
Yeah.
is really helpful, and they can help you make that
Yeah,
decision.
yeah.
If you know what, I'm having some trouble, I just want to see what else there is, and if the program is available, call us directly. You do not have to go through the emergency room to get to our program.
Okay. So I could self-refer if that's the
Yes.
route that I felt
Most
I was
definitely.
most comfortable with.
Yep.
So what other depression-related services do we offer?
So at Marlborough, you have partial hospital, and then we do have an inpatient psychiatric unit. And that is a little bit different in terms of what the needs are. If someone absolutely is having a hard time maintaining their safety, has thought about things that they actually might do in terms of their safety, and is really not able to say, you know what, I can't control this, then inpatient might be something necessary. If they're having thoughts perhaps about hurting somebody else, if they're not thinking quite right, if they're not taking care of their daily living and their daily life, those are real important things to be assessed to see if coming into the hospital 24 hours a day where you can really thoroughly be monitored, that's when inpatient would be necessary. And that would be going through a screening team through your emergency room to really assess that need versus the partial hospital.
Now, you've been doing this for quite some time. Have you gathered any information to find out whether a partial program is valuable in terms of treatment or, you know, I mean, clearly you have worked with hundreds and hundreds of people. So what have you learned over the years?
So what we do is oftentimes we had a basic satisfaction questionnaire that the patients were filling out, and it was giving us some really good input. Because we know that we have some good services and some good things to offer, that was helping us. But what we've done over the past, it's probably been about 2 years now, is really looked at a diagnostic tool. A questionnaire. It's called the Basis 24. It was developed by McLean Hospital many years ago, and we've been asking our folks, our patients coming in at admission and at discharge, to fill out this questionnaire. So within a 10 or less day period, we're really gathering some information on depression, on self-harm, on addictions. It looks at 6 spectrums, and what we've seen through all 6 spectrums is an overall decrease in symptoms from coming in to discharge in the program. And so what we're doing is taking this information. We do feel that we've been doing a good job, but there's always room for improvement. So the data that we're collecting is showing almost a 40% decrease in symptoms from beginning to end in 10 days or less. We want to continue to build upon that. We want to look at our strengths, we want to look at our weaknesses, and continue our program and develop it to meet the needs of the clientele out there.
Fascinating, thank you. Well, believe it or not, as always, our 30 minutes went by much faster than what we would have wanted it to. I think the takeaway today is that depression is certainly a powerful condition, but there's no reason to feel alone or that there isn't any treatment available. Heidi has indicated that you actually can pick up the phone and find treatment by calling your insurance company or simply calling here. There's always somebody who will answer the phone and get back to you. So I think perhaps just the fact that we're willing to talk about depression is one of the most important first steps we can take in terms of getting treatment and getting back on the road to recovery.
Right.
So Heidi, thank you again so
You're
much,
welcome.
and thank all of you.